we can divide them direct and indirect. So the direct restorative materials we'll talk about now. So direct restorative materials, that means that it applied to the tooth or teeth while the material is palleable. While the material is palleable means soft or running conditions and can be adapted, curved and finished. So we will able to adapt according to the shape and size of the tooth structures. We can apply them onto the tooth surfaces. So materials which is used, this type of restorations these are the materials: amalgam, composite, glass ionomer, temporary restorative materials, and the tooth whitening product. So tooth whitening product can be used for the aesthetic purposes, but all these amalgam, composite, glass ionomer, and restorative materials, temporary restorative materials, or we call them the IRM in short, intermediate restorative materials. These are all about our direct restorative materials. On the other hand, the ceramics like zirconia, porcelain, gold alloys, they will be considered as an indirect restorative materials. So now let's talk about the amalgam. Amalgam is very popular in dentistry. It is used more than 150 years in dentistry. Some Scandinavian countries like the Norway, Finland, Switzerland, they are not using anymore the amalgam because of the mercury. But according to the American Dental Associations, Canadian Dental Associations, mercury is still a good product. So they don't have any complaint regarding any allergic reactions or any adverse effect. So it is used in the industry more than 150 years. So mercury and the amalgam, it's a combination of the metal powders. And it's a combination of the metal powders along with the mercury. So as you know that the mercury also metal. It is the only metal which is in the liquid form. Because usually when we say something metal, we think that okay, it should be the hard. That is true, that is thick. But only the liquid form of the metal is mercury, which is liquid in the room temperature. So the amalgam, it consists of multiple metals together. That's what's called the amalgam. What are those multiple structures come together? Silver, tin, copper, zinc. And the name of the alloy is the one which is most. So one is metal powder, one is alloy. So alloy means when we mix multiple metal together, the new mixture is known as what you call the alloy. Say as for example, you have silver powder only. So you can say the silver powder. You have a zinc powder. You have a copper powder. You have, the tin powder. So they are individually called, oh, this is tin powder, this is zinc powder. But when we bring them together, say we put the zinc, copper, tin all together. So now it's known as, it's not you cannot say this is copper powder because you mixed with the silver, you mixed with the zinc, right? So now what are you going to call? You call them the alloy. What is the name of the alloy? So the one who you give most, like if you give more silver, so it's called the silver amalgam. If we give more tin, we call them the tin amalgam. That means that when the metals come together, they will make a new product, and that new product is known as alloy. And the name of the alloy will be determined which metal product is maximum used in this mixture. So that's why in the dental amalgam, it also known as silver amalgam. The reason is silver is more in the mixture than in comparison with the other metals. So as you can see here, the metals are in the powder form and they mixed with the mercury to form a soft palleable mixture. So when placed in the prepared tooth, the condensed, curved, and allowed to harden, the mixture becomes a permanent amalgam restorations. It's the picture of an amalgam restorations. An amalgam is safe, is affordable, it is cheap, it is durable, and it is predominantly the restorative for the premolar and the molar. So here the materials what we use for these purposes, it actually used only for the anterior posterior teeth, premolars and the molars. We are not using it for the anterior teeth. Yes, go ahead. Yeah, so we are using nowadays we are using the composite, that is the color match materials, but it is also effective. But when it comes to the mechanical stress, amalgam is best than the composite. So composite materials, the one you are saying that the color match, that is the composite restorations, which matches the color. So it aesthetically very good because it doesn't show anything, any metal pieces on your mouth. But when you are comparing the compressive strength or the stress bearing capability, it is still lower than that of the amalgam. So amalgam has more, the compressive strength in when you compare with the composite resin restorations. But people are liking this. So even sometimes some patients, those who have a metal filling, which is very good in conditions, but due to the advancements of the dentistry, we have some color match material, so they want to change the color. So even though it's not a good idea, but amalgam is still we are using is a it's a very good material. As you can see here, it is safe, it is affordable, it is not expensive. It is not so expensive when you compare with the composite resin restorations. Composite is expensive, but is affordable and the durable. That means durable means it's long lasting material which is used predominantly to restore the premolars and the molars because people use their premolar and molar teeth for their chewing purposes mainly. So we need something very hard so that it can be well supported for the tooth and its supporting structures. What is the use of these materials? As you can see here, this is the indications. Indication means where we can use. Indication means where we can use. So this can be used for the primary teeth, then permanent teeth. Then there is a deciduous teeth or the permanent teeth. It can be used in a stress-bearing area, that is the premolar and molar occlusal surface. It can be used to the cavities in the posterior teeth. It can be used for the destructions, serve as a destruction of the tooth structures. When there is a severe destruction of the tooth structures, we need some support. We can use this type of materials. It can be used as a foundations for the cast materials to cover the tooth structures. When the patient is committed to be personal hygiene is poor, then we can use this one. And on the other hand, the moisture control is problematic. So as I mentioned that there are some materials which is even though it's come in the saliva, they will not going to be hard enough, which is a composite the examples. So if anybody has more salivations, and it is very difficult to control their salivation process, even though we have multiple way of to control the salivations while we are doing the restorations. But if it is not enough, and if the patient's salivation is more, because some patients they have more salivation in their mouth, so that is the if there is a problematic conditions like that, we have no other choice. We have to go for the metallic restorations, and the cost is an overdrawing, the patient's concerns because it will huge difference about the costing. So that's why it is very popular in dentistry to use, and there is a safety record also. On the other hand, contraindications where you're not using, as you mentioned that okay, it is not aesthetically pleasant. When the people are conscious about their, the what you call aesthetics. So when the aesthetics is a particular an important factor for an individuals, so in that case they should not go for the amalgam restorations. With the patients who have a history of allergy to mercury or an allergy to the any kind of silver, tin, copper, nickel, because sometimes people are allergic to the nickel also, or people are allergic to the tin. If any history of something like that, because it contains the mercury, it contains the silver, tin, copper, and zinc. So if anybody has allergy, history of allergy of any of these components, so they should not go for the restorations like amalgam. When a large restoration is needed, and the cost of the other restorative materials or other treatment option is not a significant factor in the treatment decisions. So in that case, it is contraindicated. What are the composition present in the amalgam? As I mentioned, that the silver, tin, copper, and zinc. So silver, tin, and copper, zinc is a mixture. And this mixture is about like with the mercury. So mercury will be 43 to 54%, and the alloy powders, they will become up about 57 to 46%. So it's come to the 1:1 ratio. And every single individual, they have a different function. Please make sure that you remember this part. This is very important part. So silver, you know that it gives the strength. So the reason they mix come together, each and every metal pieces, they will have a different functions. So in order to give the strength, that will be a silver. So silver give us the strength. Then the next is the tin, which is give us the workability. That means we are able to work on this, and as well as the strength. Copper, it gives us the corrosion resistance. Corrosion resistance means it will prevent the discolorations of the materials. And the zinc is used to suppress the oxidations. Even though a presence of a little bit of the saliva, we can work on it because it has a zinc is present inside, which can suppress the oxidations. So this is the way the powder are come together. Now they will become in a high copper mixture. So previously, at the very beginning of the dentistry, we are using a 6% of copper. But 6% copper is not enough for the prevention of the corrosion resistance. So that's why nowadays manufacturers they add 10 to 13%, more than 13%. Sometimes it may be 15 or 16%. So when they use the more than 6% of copper, that actually counts as a high copper alloy. That means copper condition is more than 6%. So if it is below 6% of the copper, we call them the low copper alloy. So they contain a higher percentage of the copper than the previous alloys. And it can be also classified with the shape of their particle size because these are the multiple metals powdered together. On the base of their particle size, it can be round or spherical or the irregular. That can be the another way. Then it can be a admix. Admix means both spherical and the round come together. And the particular shapes, they may be characteristics of the resulting of the amalgam mixture. So it can be the round, which is spherical. It can be irregular, that means round and lathe cut together. As you can see here, these are the round particles. These are the lathe cut particles. So when they are mixed together, they can be admixed. That means here we can see the round particles and as well as the lathe cut particles. So this is actually a picture of the scanning electron microscope. We call them the SEM image, SEM, S for scanning, E for electronic, M for microscopical. So under the microscope, the materials is look like that. If we are only using the powder particles like that, the spherical shape, these are like that. They may be the lathe cut particles, they may be the mixture of both. But when we mix them, this powder with the alloy, they will be 1:1. So mercury to alloy ratio is widely used, which is 1:1. And this ratio, we don't need to mix because it is already prepared, come through a capsule. So we just only use the capsules, which is come up with 1:1. There are some non-mercury alloys are also available in the dentistry, but it is not so popular. That means here we are not using the mercury. We are using other than mercury, we are using something called the gallium. Is a composed of gallium, then iridium, and the tin that was approved by the American Dental Associations. So the gallium is composed of three things: gallium, iridium, and the tin. But it is not going further details because we have more popular materials are present here in dentistry, that is a composite. So it actually the suppressed by the dominations of the composite welding materials, but it can be also be used as a dental restorative procedures. But no clinic is used this one. Now, what is the controversial issue for the regarding the mercury? Because you know the mercury is not good for the health when there is a mercury vapor. So mercury vapor is not good for the health, but mercury itself is not creating any problem. So when the vapor will form if we use the huge amount of mercury, and if we burn the mercury, then there will be vapor. Otherwise, there will be no problem on the mercury. Say, as for example, you have a mercury filling and you start to drink a hot coffee. So that will also produce some vapor, but that vapor is not, the enough to produce any health hazard effect. So that's why this controversial issue is coming from, but it is not so established controversial conditions. But there are some countries they actually banned the mercury in their use of dentistry. So potential harm of to patients from the mercury with the mercury placed in their teeth, toxic levels of mercury vapors affecting the dental profession exposed over a longer period of time. So if it is create any big problem, so that means the dental surgeons, those who are practicing like 25 years, 30 years, or even more than 50 years, they will be the most vulnerable patient for the mercury poisoning. But we don't see something like that. So according to the ADA, American Dental Associations, and the National Institute of Health Nation Administrations, have agreed that there is no basic claims until that the amalgam is causing a significant hazard for the patients and as well as the dental team members. The risk is higher of the dental professional than the patients. Not the patient, maybe one or two filling, but the dental surgeons, they are using this one every single day. So there's a risk group should be the dental professionals. But we don't see any significant or any kind of health hazard issues. The risk decrease when we use the pre-capsulated amalgams. So that's the one thing. Mercury, if you touch by hand, it can easily penetrate the skin and then it goes to our body system. And that can be the another way it can cause the problem in our body. But in dentistry, we are not touching the amalgam. We are not touching the mercury because they come in the two separate capsules. Inside the capsule, they will mix by the help of the amalgamator. And when we open the capsule and we load it with the what you call like the metal instruments, we call them the amalgam carrier, and we bring it in the patient's mouth. And definitely when we work with the patient side, we are using the gloves. So it means that the liquid mercury is not even come in our touch. So that's the reason the risk will decrease. As you can see, the risk decreases with the use of pre-capsulated amalgam. So pre-capsulated amalgam is actually invented maybe 30 or 40 years before. And previously people using the hand mixture with the mercury. Nowadays, we are not using the hand mixture. We are using the triturators to mix the amalgam. And this is the in the clinic, every dental clinic, they will have a amalgam separators, which will protect the amalgam to be not be in the system. That can be the another system which present in the every dental clinic to collect the scrape amalgam. And as you can see here, we call it the capsule. These are the capsules. This is the capsules which contain the amalgam. And they will come in a sealed single use or double use depending on the capsule size. If they contain 600 milligram, that means it is only for a small tooth or small restorations. And it can be used for 800 milligram, which can be used for the large restorations. But interestingly, this is a one which we can add. If more amalgam is required, additional capsules can be made. We can make the additional capsules together. So that is the one of the distribution advantage of the amalgam restorations. Amalgam restorations, they will come together as a form of saying the capsule, the upper part and lower part, or this part contain the mercury and this part contain the mercury powders. So these powders and the mercury, they will separate by a diaphragm. They don't mix together until unless they go for the amalgamator procedures. So when they go for the triturations, so trituration means mixing. So the process by which the mercury are mixing together to form a mass of amalgam needed to be restored to the structures, that is called the trituration process. It can be triturated by the help of the amalgamators, or it can be triturated by the help of the mortar and pestle. Amalgamator, it is the instruments which is used to the apply to mix the amalgam materials. It can be come up with the speed and usually 7 seconds, 5 to 7 seconds is enough to mix the amalgam mass together for a single unit. Now here is the after mixing how they look like. When you mix together, it can become in the three form. Either it can be dry and crumbly, it can be the what you call like the uh, dry, or it can be crumbly, or it can be soupy like that. So if it is shiny, then it is a good one. So if it is not shiny, if it is dry or crumbly, that means we are not using. It's called the under triturations. This is under triturations. This is the yeah, incomplete triturations, over triturations. So incomplete, over trituration, both are not completable. We need a proper triturations. So this is the way usually we can see the amalgam after the triturations. So poorly triturated, over triturated, and properly triturated. So it should be properly triturated. And when you see that it is shiny, and that is called the properly triturated. So as you can see that this, the middle one, the B, that will be the proper triturations. So when it is properly triturated, its surface is smooth and shiny surface. When it is overshined, that means it is over triturated. So definitely this will not a good part to apply in the patient's mouth. If after mixing, if we see that it is this or this, we can take this, but we can also take this one, but it is better to take this one if it is the condition is like that. So that's why it means the properly triturated. A properly triturated amalgam that are appears rounded with a smooth shiny surfaces. If it is over triturated amalgam, it which is shiner, but it is the mass appears flattened, unlike a force of triturations. So these are the difference between these three mixing conditions. Okay, so this is about the amalgam mixture. So let's take a break, and after the break, we're going to continue about the amalgam procedures and composite.
Sorry, sir. Can you check my attendance because I left?